Hello and welcome to episode 4 of A Vision for the Future, a series where Imanis Life Sciences seeks to increase awareness and utilization of new technologies that will accelerate scientific progress and provide higher quality, meaningful, and actionable data sets. You can explore our previous 3 episodes with innovators from Bruker, MI Labs, and Fujifilm Visual Sonics here. Today we will be talking with Dr. Michael O'Connor, who, among his many accomplishments, is a co-founder of Imanis Life Sciences because of his expertise in NIS, the sodium iodide symporter. This video will focus on Dr. O'Connor's achievements in pioneering molecular breast imaging, or MBI. The MBI seeks to solve a very important problem. Consider this situation. A woman goes in for her annual breast exam. Her mammogram results come back negative for cancer. However, in the months following the exam, she discovers a lump, which turns out to be cancerous. How could this happen? Mammography detects tumors anatomically. As a result, high-density tissue regions, such as cancerous tumors, should stand out as white against the gray, low-density breast tissue. However, for the over 40% of women who have dense breast tissue, this test can sometimes be incapable of detecting tumorous masses. In a mammography image, dense breast tissue appears as white instead of gray, as more fatty breast tissue does. As areas of high density, such as tumors, also appear as white, they're often lost in dense breast tissue.
So one of the problems can be that you can have a tumor in the breast that anatomically will not show up at all. So it's invisible in the mammogram. And that's compounded if the women have what's known as dense breast tissue in the mammogram. So when you look at the mammogram, sometimes if it's like a fatty adipose tissue, it'll be clear, and dense tissue is white. So it shows up as white on the mammogram with the adipose tissue as dark. Tumors are also white. So if there's a lot of dense tissue, it's like looking for a needle in a haystack. You just can't find the thing.
In contrast to mammography, molecular breast imaging is a functional imaging technique, meaning it shows variations in tissue activity. MBI has an increased ability to detect cancers, especially for women who have dense breast tissue. In fact, it is 3 times more effective at detecting cancers than mammography alone. The benefits of molecular breast imaging have been proven over 2 clinical trials and a 3rd ongoing trial. As a result of its success in these trials, MBI has been selected as the preferred supplemental breast imaging technology of several institutions, including Mayo Clinic. When a patient comes in for her MBI, what can she expect? She is asked to fast for 3 to 4 hours before the exam. She is allowed to drink water and other unsweetened beverages, such as coffee. She's given a warm blanket to improve circulation for the exam. As this is a nuclear imaging technique, patients are injected with an 8 millicurie dose of sestimivir, which is a radioactive tracer. The tracer collects in areas of high activity, such as tumors, which give off gamma rays that are imaged by the MBI system.
So we have to fast, we keep them warm, and they can have their coffee. So they're generally happy. It's about 40 minutes. We have 4 10-minute pictures that we take. And so we have a little TV or an iPad they can watch TV or while they're having the exam, because it's kind of boring sitting there for 40 minutes. So we have the next generation of technology now will allow us to either cut the dose by a factor of 2 or the time by a factor of 2. And we've actually done surveys with patients and say, well, which do you prefer? And they really don't care. Actually most of them don't mind the time. But economically, it's a lot. You could actually reduce the cost of the procedure if you could cut the time by a factor of 2. So we've got the dose down low enough that we are thinking that the next advance would be to shorten down the procedure, make it 4 or 5 minute pictures, and now it's a half an hour procedure by the time you get in and get out.
Although the machine has revolutionized the field, Dr. O'Connor and his team encountered and overcame several barriers while bringing this technology to market.
MBI is a nuclear medicine technique, so they have to get licensed in nuclear medicine. So there's a lot of little things they have to do to be able to adopt the technology, which is pretty easy for a large clinic, but for a smaller private practice, they have to really want it. And that's an obstacle. Because they say, well, I'm comfortable doing the mammography and the tomosynthesis, and tomosynthesis is better than mammography, so I'm doing okay. The reality is you're not doing okay. MBI is dramatically better than those techniques. In fact, the only technique that's better than MBI is breast MRI. But breast MRI is very expensive. It's about a factor of 10 times more expensive than mammography, whereas MBI is the same price as mammography. It's affordable, it's easy to do, and it picks up almost as many cancers as MRI does, and way more than mammography.
By proving that MBI has the ability to detect 3 times as many cancers as mammography alone, Dr. O'Connor has demonstrated that it is truly an innovative and groundbreaking technology that must be incorporated in breast imaging. Thank you very much for watching this episode of A Vision for the Future. Several of Dr. O'Connor's key papers on molecular breast imaging will be linked in the description below and also on the article on our website. Imanis Life Sciences is passionate about advancing the field of non-invasive imaging. With our product line of reporter gene cell lines, lentiviral vectors, and oncolytic viruses, we support scientists from academia and industry around the world. Explore more of our product line and custom services on our website, imanislife.com. We hope you enjoyed this episode of A Vision for the Future.